Good morning. Thank you for joining us on Facebook Live. I am Nicole Moccasin, the community health worker for the Lincoln office. Today I am here with Dr. Luciana Ciobanu, our new dentist that's going to be here with us at the new Ponca Health Services Clinic in Lincoln, Nebraska. Good morning.
Good morning.
Would you like to tell us a little bit about yourself?
Okay, I'll try really quickly. So I moved to United States right before the end of the century, last century, a long time ago. I came from Romania, where I got my degree already in dentistry. When I moved to United States, I had to go again through education and get my degree. I got my degree from University of Tennessee in Memphis. Moved quite a bit around, and I ended up in Lincoln with my husband that got to join UNL University. And I worked for 12 years prior to this clinic with Blue Stem Clinic in Lincoln. And it was time for a change, and since public health is in my blood, I saw a great opportunity to join Ponca Clinic. So
Thank you.
Here I am. I think it's very important that I introduce my amazing staff, my dental assistants that will make my life so much easier day in and day out. So I'll let them introduce themselves.
I'm Berga.
And I'm Amanda Torres.
So we'll be, for right now, the team to work in Lincoln, and we hope to expand it in the future by adding more staff. But for right now, this is the team.
All right. So today we're going to talk about children's hygiene for their teeth. When should a child start seeing a dentist?
Yes, very controversial. Everybody has different opinions, but per recommendation, all the American Pediatric Society and all that, we do recommend by age 1 any child to have a first dental visit. It's not just for the kid as it is as much for the parents. There's a lot of counseling, education that we do, and I think it's extremely important that happens early in life. So by age 1, most kids will have at least 1 or 2 teeth. May not seem important, but the education for the parents is extremely important.
And then how often should they go in for a checkup?
Again, most dentists would agree that every 6 months, even if it doesn't seem like it's a big deal, it is. We create lifelong relationship, trust, and for a kid to have a checkup every 6 months will avoid in the future the fear of the dentist and all that. So every 6 months, especially they go through so many changes and growth, we try to catch anything out of ordinary. And again, each stage comes with its challenges, so we recommend every 6 months for sure. Mm-hmm.
Okay, so what should we be looking for when brushing teeth for the kids?
Okay, I don't know, maybe I'll throw this one to one of the girls. Amanda, go.
Let's see, what was the question?
What should we be looking for when we're brushing?
When kids brushing.
Mm-hmm. So for brushing for kids, you want to go in circles, especially in the back teeth, and then like up and down on the lower teeth, and scrubbing the tongue.
Yeah, scrubbing the tongue, that's a good one.
Yeah.
Mm-hmm.
Okay, so how long should they be brushing? Like, do they do the ABCs or?
We recommend brushing twice a day, once in the morning and once at night for about 2 minutes.
Yeah.
About 2 minutes.
2 minutes?
Yeah.
Happy birthday works twice, right?
Yeah.
Mm-hmm. ABC works, whatever works. Believe it or not, 2 minutes is a long time. So we usually give the kids the timers, and that can help. Or they can buy the fancy or the funny ones with lights and all that to make it fun and remind them, okay, it's not time yet to stop. So, but yes, 2 minutes is, Bayan is right.
So for children, is there a certain toothpaste and toothbrush they should be using?
In 2014, there were some guidelines changed regarding the fluoride in toothpaste. So it's not necessarily a certain toothpaste. As, of course, they all have to be approved by the ADA. It has to have the seal. I don't know where they buy, their toothpaste, but most of the ones that I know in the stores have to be approved by the ADA. As far as the toothpaste, I think it's more important the size and the amount of it. So under age of 3, it's really a smear, like a rice grain of toothpaste on the toothbrush. After 3, you can increase to a pea size, so not much. It's more because the kids don't have the swallowing, developed, or the spitting developed, so you don't want them to swallow too much. As far as toothbrushes, right? It's again about stages of life. There is now a plethora of choices in the store. You can start using finger brush, starting with cloth, and then soft rubbery ones. Kids absolutely like those, and they're small. It's the size that is important. They have to be a certain size. You cannot use, obviously, an adult toothbrush in a kid. They're way too big. So you need to have the certain size for each child age, according to their age. And obviously, we do recommend soft. Soft brush will work as good as, probably better than a hard one. We do not want any injuries from a hard toothbrush.
So, what would you say would be good foods for children?
Oh, they are
to help with their teeth?
Educate the parents and the children. So, Amanda?
Yes, what we recommend as good foods is like raw vegetables and fruits and water. And then like the bad foods is like the sugary drinks, like the sodas, the Gatorades, and then very sweets.
So yes, obviously sweets have to be limited, and especially kids are kids, they'll like their sweets. If you were to pick less damaging sweets, we recommend mostly the chocolatey stuff, opposed to sticky stuff like the Tootsie Rolls and Laffy Taffy and Skittles that everybody loves and all that. But we try to teach kids to stay away from the sticky. Even gummy bears and all those are actually extremely damaging for teeth. Right. So,
okay. So what would you say would be the best practice for good oral hygiene at home you would recommend?
This is for good oral hygiene. That's for everybody, for all of us. But especially in kids, the challenge is establishing a routine. That's why we recommend kids to come. It's all about starting early in life with a good routine. And a good routine means, again, twice a day, 2 minutes, hopefully as close as possible to the 2 minutes. And it's more about the consistency, doing it day in and day out. That's what is the best practice that you can do. It doesn't help you brush once a week. You have to have that consistency, that routine every single day. Brushing and flossing, I know it sounds a little bit too much maybe for a kid, but believe it or not, flossing, as soon as they have that contact on the back molars, and that is about 2.5, 3 years old, you have to floss your kid's teeth. And believe it or not, by age 5, at least 25% of kids have a cavity in their mouth, and most of the times it's between those two molars because let's say not many kids floss or parents' kids floss. So these are the best tips I have. Consistency, establish a routine, try to do it twice a day, flossing as soon as you have contacts between teeth.
Okay. What other problems, like if they don't build up that routine, could they get with their teeth?
Again, childhood is so full of changes and growth and development and habits that nobody really thinks much. So that's why we recommend a visit every 6 months, because each child has different developments and different needs and habits, and we can catch and avoid developmental growth problems later in life and all that. So going back to your question, that was
what problems? Other, like you said, cavities, but are there
cavities? Most of the kids, unfortunately, because of the lack of supervision or maybe skipping the oral hygiene, gingivitis is extremely common, and believe it or not, that is the first step to progress later in life to gum disease, which is not easy to treat. And again, there are other challenges with different medications, growth, like if they are mouth breathers, if they are on medication, they have other afflictions, that could damage their teeth, grinding, that is very common in kids. So there are a lot of things. That's why we recommend kids coming, because each stage comes with its challenges.
All right. Let's see. Do you have anything else to add to this, ladies?
I think covered everything, right?
I don't know. You have a long list. We
We kind of went through.
placed through all of them, huh?
Okay.
Yeah.
Okay, well, thank you, ladies, for joining us on Facebook Live, and thank you for joining us. If you have any questions, please leave your questions in the comments, and we'll get back to you.
Thank you.
Thank you.